Good morning. This morning, I am talking to uh, John Roberts, who is our holistic dental ambassador for PHA. And as you know, we are currently talking to our ambassadors and seeing where they're at and how they can continue to support PHA going forward. So it's lovely to see you, John,
Thank you very
as
much for
always.
having another chat. Looked good to see you.
It's always good. And life's been fairly hectic for you in the last year or two, hasn't it?
Yeah, it's been a gift. I was gifted the fact that I could take some time off work, which is nice. I at the same time had the opportunity to donate a kidney to my son because he only need one, and I had a spare one.
Yeah,
So my son's health has improved. He's back at work. Uh, all the better for having a kidney. I've then
fantastic.
chosen to decide what I want to do going forwards. Get away from the busyness of patient in, patient out. And I think as we go through the interview, we'll discuss what I would want to achieve within the PHA and what I want to achieve for the profession as well.
Yeah.
Um, it's a strange world at the moment in the dental profession. I've just written an article for a magazine, Conscious Smile, and there I put in, I started dentistry 45 years ago when you were fixing things. Someone had broken a tooth, you took a tooth out, you did a gas.
Mm,
Uh, Cleaning teeth was please brush up and down or side to side. Floss really hadn't come onto the market, and we were reactive.
yeah.
Now, dentistry has gone the opposite. It's trying to sell you things, trying to sell you white teeth, straight teeth. And then if you can't afford it, they'll give you the finance. And it's not about helping the person. It's become a business. And I can't knock it being a business, but somewhere in the middle is the health orientated dentist, probably the dentist that the PHA clients want to see, but we don't have those, and it has to be said, non-business orientated dentists who just want to help people. And I think this is why we are struggling a little bit to get acceptance for PHA registered or listed dentists because it is actually harder work to see a more holistically or health-minded person. And why not just sell someone white teeth, straight teeth, and no responsibility? Bit of a damning thing about my profession. I'm not afraid to say that, but there are some solutions. So go on, ask your next question. I will go on a bit.
I think it's it's all credit to you for being so transparent about your feelings about the profession. And yes, we've been working for probably 18 months to 2 years on
Yeah.
trying to bring on board more holistic dentists into the practitioner directory, haven't we? Because we get a lot of engagement from PHA members about that there's definitely a big need for this, a big calling for it. But it's not as straightforward as we originally envisaged,
No.
as you said. But that's because we've got to get it right. We've got to get it right for people, and we've discussed in the past different categories of what people might be looking for in a dental practitioner, and trying to define those categories has been a challenge in itself, hasn't it?
It's something that I've been, grumpy old man and pretty stubborn. The holistic dentistry perhaps was a lot easier 30 years ago, but as everything's got more complicated, as the internet has flourished and you read this information and that information, and if I go on about patients who and emails I've got in the past 3 days, we now have digital x-rays, digital scans, we can email them, we can analyze them. But within that comes so much understanding, and the difficulty is a divergence of opinions. What can you do? What don't you need to do? As learning goes on, why didn't you do this? Why didn't you do that? So sometimes even a dentist setting on the first step of holistic dentistry is daunting because A, it's a different direction to their colleagues. B, it's a different direction to what the accountant is saying. This is how you earn money. This is how you pay your bills. Because I know that some holistic dentists are very, very expensive, but they've seen a market there. So it's a business. as holistic dentistry, but you then embark on something that doesn't reward you financially, takes a lot more of your time and effort. You're then learning more. But if you're orientated to be that person to help and heal and become that community, which is what the PHA is looking for, then it's an absolutely fabulous way of life. But you do have to commit more than going in, drilling, filling, selling white teeth, selling straight teeth, and then going home, which equally
To
is
look at your bank account,
yeah,
your growing bank account.
it's difficult. And all of us start on the journey. I'm meeting it with a couple of holistic dentists this weekend, and between us, I think we've probably got 120 plus years, but we do reminisce about when it was easier. So we're going to see. Now, I am going to say perhaps a few things that aren't designed to upset people, but by way of explanation, we've got two things. We've got the dentist's knowledge of what holistics is, and then we have the patient's demands, or perhaps demands is too hard a word, perhaps their expectations.
Yeah,
And then when a dentist feels challenged, as any professional, be it a doctor or other, they then tend to back away and say, no, rubbish, and push you away. I can also say when someone first talked to me about homeopathy, I didn't know. So I said, I don't know. And I went away and learned. I use homeopathy and a much more advanced approach to homeopathy. Sorry to upset homeopaths, but it's a way of medicine now that is scientifically proven. It's homeopathic medicine. All we've done is change the terminology, and that's a great thing to talk about at another time. But
absolutely.
someone says, I only want to use Hep for infections rather than take the antibiotics. Well, the dentist then says, not going to touch you because medical legally you could then sue me and whatever. And it's a matter of understanding the dentist, understanding the patient understanding the dentist, this true integration. And I would often say, look, you can do your homeopathics. We're very careful about prescribing, but here's what I would recommend. But please take the antibiotics, because if this infection gets worse, it can become a problem. And then I had the patients who went out with both choices, and then depending on where they're at, they choose their journey, because at the end of the day, it's the patient's journey. But if a patient goes, no, I only want to use homeopathy, I'm going to take mega doses of vitamin C. I've been told that, da, 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 da. And if you have to take antibiotics, oh, it's going to ruin my gut flora. Sorry, you have to take probiotics, because I've seen on the other end someone with a big fat face. I was talking with a dentist yesterday. Patient had to be admitted to hospital with an urgent infection, Ludwig's angina. It'll stop your breathing.
Yeah.
And so we are on that balance board between we want to be holistic, but we have to be practical. People talk about regrowing teeth. I'm going to do that. My level of knowledge and understanding can't occur yet. And there's great people saying, do this, do that, hydroxyapatite this instead of this. It's all a bit unscientific and unproven, but it sells products. And at the end of the day, we're the clinician who's putting our reputation, our license, our indemnity or insurance on the line. So find a dentist you can work with and understand.
Yeah.
So, patients come in, well, I can't have any plastics in my mouth. I had an email 2 days ago. So I've fitted a lady with a plastic splint, helping with her headaches, no migraines for ever since she's been wearing the splint. We're talking 6 months now. And now, oh, I'm worried about the plastics in the splint. I'm sorry. There's a balance between long term, I can make something in nylon, but it's bright white. Oh, I can't wear that. It doesn't look good. So, we're always juggling. And I think a lot of the dentists who perhaps are tempted to go into the holistic field are too worried about the onslaught that comes from, can I do this? Can I do that? I've read this, I've read that. And it takes time. And for the reasons I've explained, sometimes it's better not to open that door than open that door, and it won't get lost, because it is the most beautiful, wonderful space. Patients come in, switch the TV off, switch the computer monitors off, switch the light off. I've had all those patients, who are electromagnetic sensitive. 10% of the population are electromagnetic sensitive. And as Glyn said on his interview, but it
Yeah,
affects us all. We were looking in my old practice
absolutely.
to have Wi-Fi free Fridays where the Wi-Fi's off. And then the other patients walk in and say, there's no Wi-Fi, and it's like, but we have people who are ill
Yeah.
who can't live in a Wi-Fi. And of course, you've got to think of your staff as well. So it is that there isn't.
The balance, it's a balance, isn't it? But it's also, I think, John, very much an education process, isn't it?
And,
For patients and
it,
dentists.
it is that synergy, that integration. I'm privileged to have that second degree in integrative medicine, which
Mm,
means an integration is the thing. I think the world would be a lot a better place with
absolutely.
integration. There's another conversation. But
Yeah,
the other thing with people wanting holistic dentistry now, and ever so briefly, can see a holistic dentist? Well, there are dentists who will do mercury-free, some of them mercury safe dentistry, but they'll certainly charge you well for taking out your mercury fillings. The best resource someone can go there is a website, iaomt.org. And if you put that in the show notes, I've always wanted to say that.
I
Um,
will do.
you can then go on an American website and you can then log into dentists who've registered on the American website, learned a safe way of removing amalgams. But that in itself will cost a dentist three, four, £5,000 because you've got to go to America, you've got to do this, you've got to invest
Yeah.
in equipment. That's called the SMART protocol, SMART. So, part of a continuing education program that I'm involved in, we'd like to make it smarter in the UK so we can bring this accessible to UK dentists. So you don't have to go to conferences, you don't have to sit through all these things. Just teach people and get them to understand the reason why you're drilling out mercury fillings the way we do. Not, oh, I can earn more money, there's a business in it, but it's good for you as a practitioner. Look at me, perfectly normal at 67, having drilled fillings for nearly 50 years as a student. It's good for your staff. Why would your staff breathe in all those dangers? Oh, and yes, by the way, there's the patient we're treating as well. We've got it wrong. Don't look after the patient, look after yourself first. And when that comes with an understanding, why wouldn't dentists, be they holistic or not, drill out fillings? But there is those biocompatible dentists. What are we going to put back in? Are we going to put in a titanium implant? Are we going to put in a ceramic implant? Ceramic implants cost a lot more, but I can't afford it. Well, do a blood test to see whether you are more reactive. Obviously, we'd like to put ceramic implants everywhere, but it's cost prohibitive. But titanium get you out a sticky corner. So it's that integration, it's that balance. But there are holistic dentists who are all about biocompatibility and safe materials. And yeah, please don't ask what about the plastics. It's a plastic, but we're filling a hole in your tooth. We're using the best material. And I won't go into too much detail because every dentist has their own preference. But then you have the dentists who then take it a step further. Not all mercury-free, mercury-safe dentists then talk about the infections on root canals and infections in the jawbones, because then you're getting into a lot of more expensive dentistry, having root fillings taken out, doing all sorts of surgery, and it's getting more and more expensive. So a dentist who's happily doing good, safe mercury hygiene dentistry isn't going to get involved in infections. Every dentist, be they holistic, whatever, should be having a good hygienist to get rid of the gums and getting rid of any gum disease, because that's what gave dentistry the ability to move into the body. Because I wasn't allowed to talk about mercury in your body because I was just a dentist. But then gum disease came along and suddenly, oh my goodness, it goes throughout the rest of the body. Therefore, we can treat the gums to affect the rest of the body. Heart disease, stroke, definitely Alzheimer's, anyone who's got dementia, stuff like that. Please, please, please go and see, I'm going to use inverted commas, a good dentist or hygienist or hygiene therapist who moves into that field of whole body wellness. What nutritional supplements can we use?
Absolutely.
So there's a good, and once hygiene allowed us to go into the body, then we can talk about mercury, then we can talk about other infections. So that's gave dentistry probably about 10, 15 years ago, dentistry that step into the body. So
Yeah.
you've got dentists doing the infections. Then there's a whole raft of dentists completely separate. Don't talk to them about mercury fillings or infections. These are the ones that are looking at children and breathing and non-extraction orthodontics, and they're becoming specialist practices. But if you go and see them and said, I want my mercury filling taken out and I don't want this, they don't know. But the whole thing about children and sleeping is the most important thing. I just read, I think yesterday, we're going to spend 27 years of our life sleeping and years and 5 years of our life eating. Um, eating you could do, and it's important, but if you don't sleep, and we all know, so there is a massive increase in dentists doing sleep orientated dentistry. So we're getting the children and we're saying, let's teach them how to breathe properly. And I've read some of the PHA ones about breathing. And of course, there's lots of great breathing techniques, but you still go back to the basics. It should be lips together, tongue to the roof of your mouth, breathing in and out through your nose. Going back to Buteyko breathing every day, like you're doing
Absolutely.
now. And then if you want to go on the mind altering in and out and alternate nostrils and whatever and take your trippy, then do the other breath work. But how do you breathe 99% of the time is what I've just said. And more parents are aware of children mouth breathing, poor sleeping, poor breathing at night. And so there's more and more dentists and look up myofunctional therapists, speech and language therapists are coming on board. And that is a whole field in itself. These aren't considered themselves holistic. They just don't want to harm kids the way dentistry perhaps has harmed people in the past. And then it translates into kids needing braces. So you're not taking teeth out, you're actually making the jaw bigger to fit all the teeth. And then the dentists who are treating adults, like, a couple of patients I've connected with over the past day or two. So if you get the bite right, you can improve headaches, head, neck, shoulder problems, this integration of dentists and osteopaths. And sometimes we actually have to undo all the harm that perhaps the old practice of dentistry as putting in mercury fillings, not talking about the dangers of gum disease, and worse still, straightening your teeth, giving you white teeth, and never have your teeth whitened while you've got mercury fillings in, because that'll just release more mercury into your system. But the whole thing, if you're going to have your teeth straightened and whitened, go and see someone who understands your airway, your sleeping, your breathing. But what that's done for us is create a huge difficulty in finding what category these dentists want to jump into. There are one or two, I can say half a dozen tops, who perhaps have a full understanding of this. I'm privileged, I've had the experience in this, but you know what? I don't then treat people anymore. I know someone who can treat. And today I've referred someone to London. I'm sending someone up to a dentist in Inverness. You couldn't get two cities further apart. But that's what we're trying to achieve, and we're not there yet because, as for the reason I explained at the beginning, dentists need to integrate with each other. They need to have an understanding of what the patient is looking for. And there are lots of dentists who'd love to use homeopathy and want to use nutrition as well as, but we have our rules and regulations that are so tight. If we start selling homeopathy, we're selling, in the words of our authorities, potentially something that doesn't work, and therefore you're charging something that doesn't work, and then you're in bother, which is why a good relationship with the
Well,
homeopath. But then the homeopath then has to acknowledge the boundaries that we have to work within.
yeah. I mean, it's the integrative approach. You've already said that. And it's working, collaborating together as a team of healers, isn't it?
It's a team of healers and it's putting the patient in the middle and trying to understand the desire of the patient. And it's also, I did one yesterday, sent a plan out and I said, but I'm not the practitioner for you. Energetically, and we can get into this, energetically, not the person I want to treat, to bring into my energy field. As a patient who came to see me also wrote me an email, did you do energetic healing on? Because let's be, with the quantum group that's there, the whole essence of energetic healing and us, well, teeth is energetic beings, which is absolutely don't have your teeth drilled and filled, because these are energy receivers if you want to get woo woo. And a big shout out for the dental shaman. If you look up him, Mark Mortiboys, you should have him on, because
He's on our directory, so we'll
yeah,
do an interview
I
with
would do
him.
an interview because Mark is really out there on a more shamanic journey with
Yeah,
dentistry. But it's this integration. If you want to go and see a dentist who understands energy medicine, um, and all the ramifications that can bring, which teeth, which meridians, you're going to go and ask the normal dentist, and he'll look at you blank and say, "I don't want to treat this person."
yeah.
So big shout out. I'm hoping by the middle of the year, we will then have dentists who are undergoing some form of accredited training. Two things. One might
It'll
be
be amazing.
individual topics, how to do smarter dentistry in the UK and protect themselves and the patients from mercury, an introduction to airway, and then we can point them in direction if that suits them. But remember, the dentist is sacrificing a lot of time and effort and money to learn something that you've spent hours on the internet researching. So if you have dentists, through Lisa will put up my PHA website. I'm not here to say I'm going to sort everyone's problems out, but what I will say is if you have a dentist who perhaps through a conversation wants to get on the ladder of holistic health and or dentistry for healing, bump in then, and then when these teachings come out, we can then sort of add them into a mailing list. And the big problem is it's only weekend courses or a 1 hour webinar that you do. So we're also trying to get a more structured teaching. I can't say more than that, where you will
Yeah,
have a qualification in a more integrated approach to dental medicine. That's
amazing.
in the pipeline. And then you can go to a dentist who has the understanding. They still might not do everything, but they can then be your guide into the journey of dentistry and integration with their health practitioners.
And they can join our directory so that our members can find them once they've got that accreditation and that
Yeah,
training within the category they've
yeah,
chosen.
yeah. I've just got an email from a patient who's in Tenerife, and I know the dentist in Tenerife, so I know lots of people, and I
You
can
know
speak to
everybody,
someone.
John.
Well,
Let's
no, no,
face
no.
it.
It's only because I'm so old, but I can't be helping people here, there, and everywhere. I've got to teach more dentists. So
Yeah.
please, can I have dentists, hygiene therapists, myofunctional therapists, anyone who's interested in breathing? And I am going to say you can breathe so well with your teeth as they are, but if the teeth aren't optimal, you're never going to breathe as well as you could do. You're never going to sleep as well as you could do. So my interface is it's an exciting time and
Certainly is.
stepping back from clinical work. Thank you, my son. He gave me the gift of time. Um, if we post back in another 6 months, hopefully when some of this teaching is going, and it'll be a blatant advert, but we want dentists moving into this integrative, holistic, whatever the field is, and match you with what the dentist you're looking for. All these beeps are coming up from holistic dentists who are networking, so it's good.
Incredible. Well, we'll also keep in touch with you over the next 6 months through our newsletters and
Yeah,
keep people informed of what's going on. But this is
yeah.
really exciting, and I love the
Interesting.
fact that you're now in a position to do what you're passionate about, which is training and teaching others.
And your newsletters, you had Glenn talking about EMFs. That's real for
Yeah.
some patients in the dental practice. You have patients, and you had a great article in one of your newsletters about breathing. Yeah, I do read them because I've got
Mhm.
time. But
Love to
um,
hear that, John.
but that's the thing is you've got to have a dentist who's mindful of these things and not
Absolutely.
dismissive. But it's coming. Just steady away. Give me the dentists who are tentatively, we'll give them a taster and see what they want to do.
Yeah. As John said, it's a shout out for your dentists that are receptive to this, to training and learning more, and joining PHA in delivering what we'd love to for our members. So thank you, John. It's been a
Okay.
pleasure as always. I'm sure people will be really excited to hear this, and we'll watch this space.
Thank you very much for listening. There is an email, but it's not about individuals. It's about collecting data for things going forwards. Thank you.
Absolutely. Take care.